Lady Espinosa, and I'll be validating for setup of a sterile field and what to dry dressing. I'll start by stating my 7 procedures: check physician's orders, wash my hands, gather my equipment. My equipment today is my sterile bucket, my sterile drape, my ABD pad, my sterile gauze, my normal saline, my tape, and my sterile gloves and my normal gloves, and I have a garbage set up on the side for disposal of the dirty equipment. I'll then identify my patient, identify myself, explain the procedure, and provide for privacy. I'll bring up, before I start my sterile field, I'll make sure everything's within the expiration date and that my normal saline's within 24 hours. I'll start by placing my working site up to past waist height for sterility. And I'll start by setting up my drape. This card here, ensuring that I have a 1-inch margin and that nothing falls within that 1-inch margin. If it does, I would dispose of it. I'm gonna open up my bucket, opening it up away from myself. Making sure I don't cross over my sterile field. My ABD pad.
It'll be easier this time, right? You want to try? Yeah, and then I'll try. Alright. It's not that bad. I was like, I want to remove that.
If that fell, I would disregard it. I would then check my normal saline, make sure it's within the expiration date, 24 hours. If it's been used before, I would lip it. Then I would wash my hands, place my normal gloves. Never giving my back to my sterile field, or I would have to start over again. I would then go over to the patient, side rails down, the patient at my working level. I would then drape the patient, only exposing the site of the wound. Okay. At this point, I would tell the patient not to touch the wound site because of risk of contamination. Start pulling the tape all around the 4 sides, pulling the tape away. Okay, when that's done, I would grab from the middle and pull out. At this point, I'm checking drainage, color, consistency, and any odor of the drainage. I would then discard it. When assessing the wound, I would assess it for length, deepness, or any inflammation or redness. At this time, I would remove my gloves.
Yeah, I know, I guess that.
discard them, and I would be placing my sterile gloves at this point.
So it'll be for you. Right.
Okay. If it's uncomfortable at that time, I would fix it once I have both gloves on. Okay, now I have both gloves on. I could fix it at this point. Then I would start maintaining sterility. Damping it. This would be my clean hand, but not contaminated. Cleaning from the middle, up, down, disposing, not cross-contaminating. Grab a clean gauze, dampen, hand it to my other hand, outer, up, down, dispose. Okay. Maintaining my hands above base height. Pass over, and then more. Dispose. Okay, at that time, I would place dampened, 2 to 3 dampened with normal saline gauze, depending on the size of the wound, to impact the wound. Cross over. And again, I said 2 to 3, depending on the size of the wound. Once that has been placed, I would then place my ABD pad. Oh, once the inside has been impacted with gauze, I would drape with 3 gauzes on top. Okay. I would then place my ABD pad, making sure the blue line's on top. Okay. Once that is placed, I'll remove my sterile gloves, discard. I would grab my tape and tape the wound, making sure it's not too tight. All 4 corners. Once my dressing is placed completely, I would recover the patient, redrape him, place those rails up, lower the bed to the lowest working position and a comfortable level for the patient. I would provide the patient with the call bell. I would then wash my hands, record everything in my eye and nose sheets and my nurse's notes. I would make sure everything has been discarded and thrown away, and then I would provide for privacy for the patient.